In this surgical video, we will show a novel approach for endoscopic dacryocystorhinostomy, which we name the Transet model. Using a 0 degrees nasal endoscope, we identify the most anterior anatomical landmarks, namely the inferior turbinate, the head of the middle turbinate, and the maxillary line. After reduction of the middle turbinate, we proceed with the retrograde inferior uncinectomy using a backbite forceps. From an anatomy-driven surgical perspective, we currently do not rely on rigid light probes to locate the projection of the lacrimal sac on the nasal mucosa. On the other hand, the lacrimal bone is identified after performing the uncinectomy and agernasi opening, confirming the close relationship between the cranial portion of the uncinate process and the lacrimal bone on the lateral nasal wall. Using a cottle knife, a C-shaped mucosal flap of approximately 5 mm of thickness is removed from the frontal process of the maxillary bone, represented by the maxillary line. At this stage, using a diamond burr and a 45 degrees angled scope, we proceeded to drill the lacrimal bone with a gentle craniocaudal motion. After proper drilling, an adequate exposure of the lacrimal sac may be achieved. Using a Baumann lacrimal probe, we confirm the projection of the medial aspect of the lacrimal sac onto the lateral nasal wall. At this point, the sac is incised using an angled beaver knife. Lacrimal mucoceles should be drained in this step. To reduce the risk of postoperative scarring obliteration, it is paramount that lacrimal stoma to be as wide as possible. In this way, sometimes it is possible to identify the lacrimal canaliculi. Finally, a bicanalicular silicone stent is inserted through the stoma and left in place until the local healing has been achieved, at least 3 weeks after surgery.